Welcome to the Midwestern Regional Health Network Interoperability Technical Assessment and Recommendations. Presented today, I am Tara Medina, and this is my partner.
Debbie Chaco. In our agenda, we will do a follow of the Connected Care of 2026 vision, includes the overviews, goals, the current state, the gaps, implementation summaries, and recommendations on the next steps.
First, we'll start with an overview of Midwestern Regional Health Network. They are a diverse healthcare ecosystem. They use Epic as their primary EHR. The clinics in the rural areas retain use of legacy EHR systems. There are hospitals, clinics, and there is an urban and rural setting.
Our goals for Connected Care, as are shown in the slides, are for achieve full interoperability across all care settings. We will modernize rural and legacy EHR systems. Standardized data for accuracy and compliance. We will implement semantic interoperability using SNOMED, CT, LOINC, RX norm, and USDI standards. We will ensure privacy and regulatory compliance with alignment with the 21st Century Cure Act requirements. We will increase patient engagement by enhancing usability of digital health tools and improve clinical and operational outcomes by reducing medication reconciliation errors and prevent missing clinical histories, and validate monitor system performance by continuing with regular maintenance, testing, and upgrades as needed.
The current state of interoperability maturity, we're looking at the HIM, SS, MRAM stages. The hospitals are at stage 6, showing advanced data exchange, patient engagement tools, and health analytics capabilities. Clinics are at stage 5 with integrated data across platforms, some telehealth support, moderate patient engagement. The rural facilities are below that stage 5 due to use of the legacy EHR systems and minimal real-time exchange with low semantic standard adoption. The standards in use include HL7, Fire APIs, and partial use of SNOMED CT, RX Norm, LOINC, and USCDI. External exchange is through eHealth Exchange and Epic's Care Everywhere network.
As you can see, this is our interoperability gaps and impacts. The types of interoperability are foundational, and the current challenge is the network band constraints. Impact will limit information availability and violate Secure Act requirements. Structural is inconsistent wearable integration, which will break workflow continuity. Thematic is rural clinics' use of non-standard coding, which will reduce analytic accuracy. And organization for interoperability type. There will be a rural staff training, which will lead to limited consumer engagement and coordinated care.
Here we have our recommendations for improvement. So we're looking at the same interoperability types as the slide before. The actions we are looking at taking for foundational include full Epic integration and upgrading the rural infrastructure. The benefit of this is the real-time data exchange and telehealth availability at all locations. The structural interoperability type, for actions we would standardize all interfaces and implement the 21st Century Cures Act interoperability requirements. This will ensure consistent, secure, and scalable integration across care sites. For semantic interoperability, we are looking to implement centralized terminology services and integrate wearable and behavioral health data with the rest of the data in the patient's chart. This will improve clinical decision support, analytics, and population health management. Organizational interoperability actions include targeted interoperability training, patient portal outreach and education, encouraging safe use of patient-generated health data. This will strengthen care coordination, patient engagement, and trust in the system.
This is a process map with concerns and proposals for resolution, and our main groups are security and compliance, mobile tech wearable device, patient portals, Epic telehealth, clinic legacy EHR going to Epic Care ambiguity, which will be an external exchange of information for Healthy Planet, Care Everywhere, and eHealth Exchange. And our last group is pharmacy, labs, behavioral health with custom-built interfaces.
There are 4 test scenarios that we're going to discuss today. These are some examples of things that we will test to make sure that everything is working appropriately. Our first test scenario includes medications ordered by a clinician. For this, we want orders to be received accurately by the pharmacy and the updates to the EHR MAR to be accurate. We will also test telehealth visits from rural clinics. The expected outcome for this test would be fast, uninterrupted, clear connection for a telehealth visit. We will also test the MyChart registration process. For this, we will hope to see increased patient adoption of MyChart and pre-registration for visits both in person and virtual, and the Apple Watch data integration. This will show data from the Apple Watch populating in the trends report in the patient's chart.
The consumer engagement strategy and the use case will be a patient with diabetes using the facility's telehealth system for a follow-up appointment. The primary goal for the patient to access telehealth visits seamlessly and efficiently with their clinicians. The test scenarios are as follows. Schedule a telehealth visit, fill out consent and pre-assessment paperwork, connect to a telehealth visit through MyChart, and review after visit summary.
For our usability plan and analysis, we looked at 3 different personas with various ages, locations, tech-savvy ability, access methods, and special considerations. The key takeaways that we have based on this assessment is to provide connectivity guidance, advising rural patients to use hardline internet connections to reduce lag and improve visit clarity, to provide language selection during scheduling and include an interpreter option, to send reminders or alerts to complete consent and pre-assessment forms at least 24 hours before the visit, to optimize scheduling and provider workflows to minimize patient wait times, and the need for intuitive, user-friendly formats for better patient engagement and satisfaction.
Implementation summary is as follows. The MRHN current interoperability maturity is uneven across care settings, with hospital leading and rural clinics lagging. By aligning terminology standards, modernizing infrastructure, standardizing interfaces, and improve organization adoptions, the facility can achieve its Connected Care 2026 vision, ensuring seamless, secure, and patient-central data exchange across the continuum of care.
Our priority of recommendations and next steps Based on the information we have shared, our high priority items will be foundational and semantic interoperability. The medium high would be structural interoperability, and medium would be organizational, consumer engagement, validation, and monitoring.
Thank you for listening, and let's get connected.
Thank you, and here are our references for your viewing pleasure.